The meeting will now come to order. The Board of Aldermen meets on the second Tuesday of each month at 6 o'clock p.m. with a pre-agenda meeting on the Thursday prior at 5:30 p.m. The primary purpose of this meeting tonight is to review the agenda for the upcoming regular meeting on Tuesday, set the consent agenda, hold public hearings, receive other presentations. Regular meetings focus on action items, departmental reports, and other business. Both meetings are open to the public and are held in the Hilda B. Palmer Boardroom in Town Hall, located at 460 South Salisbury Avenue. A printed copy of the entire agenda packet is available in the boardroom for public use. Please find meeting agendas, minutes, and a link to view the meetings live or on demand at spencernc.gov. Okay, would you please rise for the Pledge of Allegiance, and then I'll follow it with the invocation.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Please bow your head for the invocation. Tonight we ask that you guide each of us in our seeking to serve citizens and address their needs and concerns. Give us discernment, wisdom, and the ability to work together for the betterment of the town we all love. Amen. Okay, we are now going to review the agenda and see if there's anything that should be moved to the consent agenda or added. Does anyone see anything they want to add? The minutes are already on the consent agenda.
Madam Chair, I think I'd just like to acknowledge the donations to the fire department and police department, if you could.
Okay, which number is that?
That is item B and C under the consent agenda.
Okay.
Are you asking to pull those off the consent agenda? Or
that's the way. That would be the way we would need to do it to recognize that. Is that correct?
we could. It just depends how you'd like to do it. If you want some information, we can talk about it. But either tonight or in another format, maybe during departmental reports, or we could pull it off for separate items for you to vote on individually.
Well, let's just do it in the departmental reports, if that's okay. Is that
This
acceptable?
This evening or on Tuesday?
On Tuesday.
Okay.
On Tuesday.
Okay.
So, and if I may, we do have before you one item that we would seek to add as an add-on to what you already have in the packet. It is something that perhaps could go on the consent agenda, so we can go over that whenever you'd like. And then the other thing I want to make you aware of is we would like to do our police departmental report this evening. Chief File is not able to join us on Tuesday, and we actually have our code officer, Preston Eagle, here tonight, and they've got some information to share. So we were hoping to accomplish that police report this evening.
Okay.
That's acceptable to me.
So we add this to the consent agenda also.
If
Is that the motion?
No, I think we will address this in the police department report tonight.
Oh, okay. Sorry, I missed it.
Either way, yes. Yeah,
Okay.
you could actually. I mean,
okay, that sounds.
What this is retroactive permission related to a grant that we got a very short application window to handle. So we were just going to update you on that.
Okay, that sounds good. Okay.
So, Madam Chair, I propose to, I move to accept the consent agenda as it's been amended.
Second.
Second.
Okay, all in favor? Okay, the motion carries. Yeah, I'm getting ready to go to that right now. And so the consent agenda then is set. Next, do we have a volunteer who would like to lead the invocation on Tuesday? Okay, Mr. Miller, thank you. You want? Anyone? Oh. I don't know, I haven't seen any. They're gonna be on Tuesday, okay.
So sometimes we'll have a public hearing at our pre-agenda, but there were none scheduled for this
Yeah,
one.
okay, so that's good. Thank you. Thank you for bringing that up. Okay, are there any additional comments for the minutes reviewed by Mrs. Sledge for August the 7th and 12th? And they are going to be kept on the consent agenda. No additions or changes in the minutes, okay? Are there any deletions or any other additions to the agenda? Okay, let's look at recognitions. Does anyone have any recognitions that they want to make on Tuesday night?
Yes.
Okay.
I'd like to make a recommendation in honor of the JCs and their event last Saturday night.
Yeah, I heard it was spectacular. Okay, and you'll take care of that, Pat.
And,
Okay,
and just a
thanks.
point of information on that one. So the Labor Day event was, the primary organizer was the Spencer's Holiday Caravan group, and the JCs, I think, were kind of a contributing partner, but the primary recognition goes to the Spencer's Holiday Caravan.
And a lot of the JCs are members of the Holiday
Yes.
Caravan Committee too.
Same
so
people.
They work in tandem,
Yeah.
so they've really done a lot for the town. And many, many thanks to them. Thank you, Pat. Any other recognitions? Okay. Well, if anyone thinks of something that you forgot, just get in touch with Anna, and we can probably still add it, if you can let her know by Monday. Okay, we're now going to read the agenda out loud and then move to the consent and get the and read the agenda out loud and set it. But do you want to do the police report first, or?
I think it would be okay to go through these items we have, and then
Okay.
we'll do the police report, kind of where it appears, which will be
Okay.
after we get through some of these other items.
Okay. Okay, so we will start with the call to order and the invocation and pledge, additions, deletions, adoption of agenda, the recognitions, and right now we just have one, public comment, and we probably will have several on Tuesday evening. Then the consent agenda, and then we'll consider appointing Danielle Yearout to the Community Appearance Commission. I hope I pronounced her name correctly. Number 9, consider adopting ordinance 25-11.01 fee schedule amendments. Number 10, consider adopting ordinance 25-17 approving temporary road closures during Spencer's Holiday Caravan Parade. 11, consider adopting interlocal agreement with Rowan County for the erosion control. 12, informational update. Town staff to draft the water sewer main extension policy. 13, informational update. Town staff to investigate costs of striping plan consultant and use of bike lanes on Whitehead. 14, departmental reports. 15, town manager report. 16, requests and comments by the mayor and board members. And then executive session if needed, followed by adjournment.
I do have, I believe, in addition, I think we're slotted to receive our county update on the community health needs assessment this month
Oh, okay.
on Tuesday. So we should probably add that.
Yeah, and that probably could go right after the consent agenda.
That'd be great.
Uh,
So bump everything down one, and that becomes
Okay.
number 8.
and that-
Thank you.
That's
Ms.
Courtney
Moody.
Meese. Is that correct?
Yes, who is with us this evening?
Okay.
Is she prepared to do a presentation this evening?
Yes, you are this evening. So I don't know. We could do that this evening or Tuesday, whatever your.
It's up to her and y'all. Yeah.
Well, as she's here this evening, we may as well just receive that report now and not make her double that. If everyone's okay with that.
Are you okay with that? Okay. Okay, then we'll proceed with that. Okay. Anything else?
Madam President, just a thought, and I'm not trying to give short shrift to the parade folks, but in terms of considering, do we need to consider adopting this temporary road closure? Is that something you can go on consent?
Do we need to consider what?
In other words, the road closure issue.
Yeah.
I don't think there's any controversy there. Is that something we can put on consent?
Oh,
Unless we
okay.
just want to hear from them.
Well, my only question about that would be for residents who might not be familiar with it from last year. At least they will hear about the plan and what's to be closed, so that they will have a heads up on it.
Sounds good.
Okay. So we'll just leave it where it is then, because there may be someone that's moved into the neighborhood since then. Okay, any other comments about the agenda?
Madam Chair, I move to accept the agenda as presented and amended.
Okay, is there a second?
Second.
Okay. Okay, all in favor? Thank you, Alderman Sledge and Alderman Muhammad. Okay, and
So our two things then would be our police report,
okay,
and also the report.
from the
related
community
to-
health
yes.
assessment. Do you want to do the community health assessment first?
Is
Is that okay with you?
Yeah.
Okay,
Let's
thank
go.
you.
Let's go for it. Everyone's excited and ready to go, so we'll get them both handled.
Yes, come on up to the podium. Sorry.
Good evening. We're not morning. That's tomorrow.
Same.
Good evening. My name is Courtney Meese. I'm with the Rowan County Public Health Department. I'm the Community Health Manager, and I also serve as the Healthy Rowan Executive Director. Healthy Rowan is our community coalition. And I have a lot of information that we're just going to go through rather quickly, and then I can provide these slides. I can send them to Anna and have them sent to you all. We have a whole slide deck of a lot more extensive information than I'll cover tonight.
Okay.
But feel free to review them, disseminate them however you please with your residents. So we'll just dive in. So the 2025 Community Health Needs Assessment, I'll refer to it as the CHNA from here on out, Community Health Needs Assessment CHNA. It is a comprehensive assessment that is done every 3 to 4 years. So every 3 to 4 years is considered a cycle, and it's mandated by the North Carolina Public Health Accreditation and the Affordable Care Act for nonprofit hospitals. So Novant Health Rowan Medical Center, they have to conduct a CHNA at the same time that we do. So we collaborate on our CHNAs to make sure that we are aligning the priorities of the community. And then every other cycle, we get the opportunity to partner with our Rowan County United Way. So that's now. We're on that cycle. So Rowan County United Way, Novant Health Rowan Medical Center, Rowan County Public Health, and Healthy Rowan are working collaboratively on this assessment. A lot goes into it. Erin actually got to sit on our steering committee for the whole process, and we collect primary data, so surveys, focus groups, secondary data from various sources, national, local, and then some of our local nonprofits have provided information to us of, and then after we review all that information, we select our priority health areas, which we'll go through some of our primary and secondary data, and then I'll get to what our selected priority health areas are. But the benefits of a CHNA is that it provides a picture of the county and the health of its residents. It assists in decision making, so helping us figure out where we need to allocate our resources, our staff time, our grant funds, and it also gives us an opportunity to advocate for different health areas and then provide a call to action for some of our local nonprofits. So we collected.
It's persnickety. Sometimes you have to point it backwards. I don't know why.
There we go. All right. So we collected primary data, which you can see here. We collected 1,303 surveys from county residents that were over the age of 18. Majority of those respondents were over the age of 65, and majority of those were male. So these numbers are weighted to give us a better representation of our population. And then for race and ethnicity, majority of our respondents were white, but that is reflective of, when we get to our community snapshot, that is reflective of what the county makeup is for white, African American, Hispanic. All right, so as far as employment status, the majority of our respondents were retired, which makes sense seeing how majority of our respondents were over the age of 65, followed by full-time individuals who were employed full-time. As far as education, majority of our respondents had a college, were college graduates or had further education beyond a four-year degree. Household income, majority was between $50,000 and $74,999 a year, and that tracks with our median household income that the U.S. Census reports. And then lastly, household status, majority of our respondents did own their own homes, followed by individuals who rent their homes. So survey dissemination, we collected surveys between February 19th and April 11th of this year. We sent out QR codes, there was links, we used a variety of different listservs, social media, we went out to community events, we did a couple press releases. We also sent mailers out to all the churches in Rowan County, and y'all, that's a lot. There are over 300 churches in Rowan County. Fun fact. And we also distributed it to our Help Your Rowan partners and then asked them to disseminate. So some of our limitations is this, our primary data only reflects those individuals who completed the survey. And that's off of a convenient sample. Findings are not comprehensive, so we would have to do a little bit deeper digging if we wanted a very comprehensive level. And then it doesn't highlight subpopulations or modeled estimates. All right, so our community snapshot. I don't know why my graphs aren't working on my computer. Okay, so community snapshot. Our county is pretty much split between male and female, with females just making up just slightly more of our population. The majority of our population is 0 to 19, so our school age kids, and then our individuals in the workforce, so 35 to 54. And then race, the majority of our population is white or white non-Hispanic, followed by Black or African American individuals, and then individuals who identify as 2 or more races and some other race. This is wording that comes from the census. I don't particularly love the wording of how they classify race and ethnicities, but to keep everything the same. Life expectancy. So Rowan County, we do have a lower life expectancy than our peer counties and compared to the whole state of North Carolina. In some of my slides, you'll see a box, like this red box. So those are the indicators for Healthy North Carolina 2030. So this is what the state the state's goal is. So you have the target, and then you have where Rowan County falls. So we're almost a whole decade behind the target for Healthy North Carolina 2030. I don't love to think about this as like we failed. We have work to do, and I mean, I think that's the best way to look at it. Is it just motivates us? It gives us something to work towards. Birth rate, there is a baby boom going on in Rowan County. We are seeing a lot more of our younger families coming in, settling, planting their roots, and then raising the next generation of our county residents. So aside from Iredell County, Rowan County has the highest birth rate for women between the age of 15 and 50. And this increased significantly between 2016 and 2023. Aside from what you're hearing on the national level, we are seeing a trend upwards. I know some news outlets report that we are seeing a decline in birth rate nationally, but here locally we're seeing an increase. Social determinants of health. So this is where people live, where they play, they age, they work. These factors play a lot into the health of health outcomes. So employment, we have listed here the top 10 employers of Rowan County. Highlighted are the top 5. So the VA Medical Center, Food Lion, Rowan Salisbury School System, Freightliner, and Novant Health Rowan Medical Center. There are other indicators that I wanted to point out are unemployment rate. We have seen a decrease in the unemployment rate between 2017 and 2023, and there has been an increase in the median household income between 2017 and 2023. However, if you remember what happened in 2020, COVID, and in addition to COVID, inflation really skyrocketed. So while it is a good thing that we are seeing an increase in median household income, that $3,000 is not going too far when you account for transportation, housing, childcare, food, all the things. That $3,000 doesn't make a huge difference. All right, so median gross monthly rent. Rowan County has the second lowest median gross rent amongst our peer counties and lower than the state. This is between 2019 and 2023, so I'm sure the number has gone up a little bit since 2023. But between 2019 and 2023, there was, on average, people were paying $990 for rent. And the map to your right shows where people are renting in the county. So we do have a lot more people in Salisbury, Spencer, East Spencer, and then down in the Kannapolis area who are renting. And this could be attributed to a variety of different things. A lot more people are drawn to these areas because there are a lot more resources. The resources are more condensed. There are bus lines. And typically in our smaller municipalities, they have a lot better walkability. So homelessness, every year Rowan Helping Ministries conducts the point in time count where they measure on any given night what the number of individuals in the county who are homeless. So they break it up by sheltered and unsheltered. So sheltered could be they're staying in the shelter, they live in transitional housing, or individuals have deemed themselves or considered themselves homeless but have some sort of shelter. Unshelter is that they are living outside. This number does not account for individuals who are living possibly in motels or hotels, or they're staying with Mr. Muhammad one night and then staying with Miss Moody one night. So moving from one place to another every other night. So that's not reflected in this number. Food insecurity. Rowan County has the highest percentage of residents who are considered food insecure, with between 2018 and 2023, 16% of our residents were food insecure. And then the same for food insecure children. In 2023, it was 21.2% of children in the county were food insecure. However, I will point out that I'm hopeful that these numbers have decreased since 2023 with Medicaid expansion. So when an individual or a household is eligible for Medicaid, they're also automatically eligible for SNAP benefits. And if one of the individuals in the household is pregnant or they have a child under 5, they are also automatically eligible for WIC benefits. So hopefully these numbers have decreased, but public health data is very slow for updates. So it'll take a little bit for us to find out for sure. Third grade reading scores, we are lower than the rest of our peer counties and the state, and this was even before COVID. And this is the most recent data we have, and it's from 2019. But regardless of how our third graders are reading, it does look like in the high school graduation rate graph that our students are able to cross that finish line and get their diploma. So they may not be reading great in third grade, but they are finishing school in general. And then you have another Healthy North Carolina 2030 objective. So the target is for reading proficiency 80%, and Rowan County is at 30%. So we just got a little work to do. Crime index. This accounts for all crime, property crime, violent crime. The perception is that crime is getting a lot worse, but as Miss Moody will tell you, that I presented to Rowan Rotary, and Chief Smith with the city of Salisbury was in there, and he said that this does track, that we are not seeing. You hear in the news a lot, the squeaky wheel gets the oil. So if you're hearing about crime a lot, your perception is gonna be that crime's getting a lot worse. But it's actually staying relatively flat. That line is staying kind of flat. And Chief Smith did say that that is accurate. So health factors, this is access to medical, dental, and mental health services. So health insurance, uninsured, between 2019 and 2023, the percent of residents in Rowan County who were uninsured, it was just over 10%. And the same can be said, uninsured children, 0 to 4, there was just over 4%, and then 5 to 17, again, just under 5%. So again, this number is only through 2023. So with Medicaid expansion, we're hoping that individuals were able to get enrolled in Medicaid. But we do still have a higher uninsured rate, higher than the North Carolina 2030 objective target. Primary care workforce, Rowan County has the second lowest primary care providers per capita, so physicians per 100,000 residents. So we only have 34.7, so we'll say 35 providers per 100,000 residents. And not all of these providers provide care for individuals on Medicaid. Yes, Medicaid. And this number also includes physicians such as primary care, general practice, internal medicine, obstetricians, gynecologists, and pediatrics. So dental workforce, it's about the same story. So we have 36 dentists per 100,000 residents, which is a lot lower than the North Carolina and United States rate. And only 13 of these providers in Rowan County accept Medicaid, and only one provider is a pediatric dentist, and only 2 of these providers are orthodontists. So that's creating a huge barrier for our child population and then our teenage population. Mental health provider workforce, this number looks a little better, but let me explain. So there are 405 mental health providers per 100,000 residents in Rowan County. That sounds great. However, this number does include mental health providers who work for the VA. So they have a ton of providers However, those providers are not accessible for all of our residents. This number also includes psychiatrists, psychologists, specialists in addiction medicine, counselors, therapists, and behavioral health nurses. So not all of them are able to like specialize in like your basic talk therapy. So we still are behind several of our peer counties, the state, and the U.S. Health outcomes. So our leading causes of death in Rowan County are listed here. They're the top 10. The ones highlighted are causes of death that could be attributed to chronic diseases. So with that, it tells us that we are able to put maybe a little bit more attention and a little bit more care into our preventative health measures or preventative health screenings and preventative just prevention. We could lower these. And also, I have provided here the North Carolina rate as well as the Rowan County rate for each of these leading causes of death, and each of them we are higher than the state rate. The coronary heart disease, Rowan County is higher than the peer counties, North Carolina and the U.S. for coronary heart disease, and the map will show you where the most prevalent areas in the county where coronary heart disease is the most prevalent. And then, so one thing to note is that these communities that are a little bit darker, they are older communities, and I have another slide about chronic COPD, and you'll see that they look very similar. So we'll just skip forward to COPD. So COPD, highest amongst peer counties, the U.S. and North Carolina, and the map also looks very similar to the coronary heart disease map. So individuals who are older possibly have a higher likelihood that they had smoked at one or used tobacco at some point in their life, and so those are considered comorbidities. Usually, if you have one, the other one follows closely thereafter. We'll go back a slide. Cancer. So we do have one of the lower rates of cancer. I thought this was very interesting when I first saw the map because I was like, oh, it's in our more rural areas, you know, like farming areas. I was like, I bet you there is a lot of this is because of skin cancer. Like people are outside, they're tending to their gardens or their farms. Skin cancer is not included in this, but through speculation, what we're thinking is it still has something to do with farming, but it could be because there are different exposures, chemicals, different exposures to different things. We are also in the North Carolina slate belt, which affects our water, so that could also play a role in it. But these maps, I just geek out over them. I love them. Okay, adult diabetes. We do have the highest rate of diabetes compared to our peer counties, the state and North Carolina. And one thing I will point out is that for diabetes mortality, our non-Hispanic Black residents are dying at much faster rates than our white than their white neighbors. Whenever it comes to diabetes. And that could be from a variety of things. It could be from access to preventative health measures, not being screened regularly, diet. It could be a variety of different things. All right, substance use. We do have the highest, or in 2023, we did have the highest amongst our peer counties. The state and the U.S. for drug overdose mortality. I will say that this was prior to the opioid settlement, since there has been some really great work that's been going on in the county. So we have now fallen, I think, outside of the top 10 counties in the state. So that's great. A lot of work is being done through our HOPE team. Emergency department visits due to medicine and drug overdoses have been on the increase since 2019, and we're continuing to see those increase. And then we are nearly 3 times higher than the Healthy North Carolina 2030 objective for their target. Did you have a question? We're working on it. We have room to grow. It gives us something to work towards. So mental health, our suicide mortality rate has been all over the place since 2017. We are not the highest, but we are not the lowest. We're kind of in the middle of the pack. And then we are still higher than the target for suicide rate for Healthy North Carolina 2030. All right, our priority selection. So we asked in our survey, we asked citizens to select the top 3 health-related challenges that they see in the county. And the top 3 for health-related was mental health issues, access to affordable medication, and substance use, so drug and alcohol use. We then asked them to tell us what they thought the top 3 community issues were. And they told us that affordable and safe housing, access to affordable healthy foods, and safety and crime were the top 3 community issues. So we took all that into consideration. Like I mentioned earlier, we had a steering committee for this CHINA, and it was made up of 23 individuals who served in a variety of different sectors throughout the county. Ms. Moody was able to serve as a representative from a youth serving organization with her job at Terry Hess Child Advocacy Center, and then also as a representative of a municipality. So just to give you an idea of how we broke it down, we wanted municipality representation, we wanted some different sectors that work in the realm of public health and nonprofits. So in May of 2025, the committee took all the current health stats, so everything I just presented and more. They looked at the survey results, they looked at focus group results, and then they also considered the presentations they heard from our community experts. And they rated these priorities based on magnitude, so how big of an issue is it, seriousness of consequences. So if we didn't do anything, what would happen? And then feasibility of impact. Is this actually something that we have the capacity to fix, or is this beyond us? And all that for this. So our 3 priority health areas are behavioral health. So we coupled substance use and mental health together because truly it's a chicken or the egg situation. Housing, so affordable housing, accessible housing, safe housing, and livable housing. So we want to make sure we're going to be working with a variety of different partners to make sure that we are addressing all those areas of housing. And then healthy lifestyles. We want to promote healthy behaviors and healthy environments, chronic disease prevention, and then increase access to preventative health care, physical activity, and affordable and nutritious food. So what are our next steps? This is the last slide, I promise. So we are working on publicizing and distributing our information that we've collected. So this is public presentations, working on an executive summary, and publishing the Community Health Needs report. The report will be due in March. So we're kind of doing a dog and pony show where we're going around and sharing all this information with different municipalities, different groups. Then we're going to develop task force and action plans. So what are we wanting to do now that we have our priority areas? How are we going to address it? And we're going to create some measurable results that we are going to be able to track until our next CHINA. Then program implementation. So we're either going to start new programs or we're going to find local programs that we can help lift up and support to make sure that we're not duplicating services. Because that doesn't help anybody if we have 10 people doing the same thing when we could just work together. And then we're going to continuously monitor and evaluate the programs that we are working on or supporting to see if they are contributing to our overall outcomes that we're looking for. So that's everything. It was a lot, but I hope you found it interesting. And if you have any questions, I can take questions.
I see Pat's note sheet.
Yeah, I have questions.
That's good.
Yeah, first of all, let me just say that a lot of this is very disturbing, you know. On the third grade reading thing and the graduation rates, how do you feel like, is there an impact with dropouts for those kids that didn't read at third grade? Do we think they made it to graduation, or do you think they just weren't in the count?
So it's hard to say, but I know from a national level and a societal level, there is a correlation between third grade reading proficiency and the development of prisons. So there is a school to prison pipeline, and I didn't know that until I started working in public health, and that's very disturbing. So it's hard for me to say from a local level, but from a national level, that's kind of where it trends.
Some of the things that you noted were an increase in the Medicaid expansion for this year. And this is probably a question you can't answer, but changes that are being discussed at the federal programs, how do you think Rowan County will be impacted by those? Is there any feel for it? Are we too far? Is it so far out that we don't have to worry about it in this particular study?
That's a very difficult question for me to answer, but I will say that our public health team and our health director has a really good pulse on what's going on. We talk about it nearly every management team meeting just so we can stay abreast of what's going on. I think we will see some impacts, but it's hard to say, and I don't think those impacts are supposed to come until a couple years down the line. So things could change, but it's hard to say at this point.
And why do you think that Rowan County is deficient in local doctors and dentists?
That's a great question. So someone on our steering committee mentioned that when they try to get providers here, a lot of times we're trying to get providers here, but those providers have families. And sometimes when your school system's not thriving, it's difficult to get people to move to an area. I will say we had a community expert from the community care clinic visit us to give a presentation, Miss Krista Woolley, and she said that I forgot the exact phrase that she used, but essentially our nurse practitioners and our physician's assistants are going to ultimately be a key in changing some of the trajectory of where that primary care workforce is coming from, because they do have the ability to do more than a registered nurse,
right,
and be supervised or work under the license of a physician. So those are going to be like where she thinks putting some resources to recruiting those middle providers. Is that what she's referred to them as?
So are schools turning out more of them? Do you know?
I don't know, but I do know that there are a lot more nurse practitioners and physician's assistants than there were in the past. Mm-hmm. A lot of nurses are going back to get their nurse practitioner, so they can practice a little differently than a regular nurse.
And I guess you've answered my first question, was, do you feel that some groups are missing in this count? And, you know, you can't give people a QR code who don't have access to.
Yes, ma'am. Yeah. Absolutely. And I think there's also a hesitancy of people participate. We are a government agency, and so a little bit of a hesitancy of participating in
governmental studies.
Yes, ma'am.
Yeah, I understand. Thank you.
You're welcome. Any other questions?
You provided a wealth of information, and as Pat said, some of it isn't pleasing to look at, but it does give us a roadmap to where we need to go, and there's plenty of places to start.
Yes, ma'am.
So I hope all of our citizens will pick out one area from this that you think you could help in, whether it's helping get kids and people to the doctors, supporting the schools. There's all kinds of places for us to help make Rowan County better, and we're going to have to do it together.
Absolutely. And one thing that we talked about in our Healthy Rowan meeting just last Tuesday was being trusted messengers. So I've given you all this information,
Yeah.
and you are, you're elected officials, so obviously people trust your opinions to put you in these spaces. So taking this information and sharing it with others as a trusted messenger. And I will say that we do have some really cool grants out on the horizon that could be coming that can address some of these health disparities. So that's really exciting.
Good news.
Yeah.
And if I may, I just wanted to just maybe offer one additional point of connection of some things happening. And you've got one of the priority areas and the top area on the survey emerging as with affordable housing. Saw the information you had sent earlier today about this health equity zone and the opportunities that may be coming there. I was in Chapel Hill yesterday and today with a group from Rowan County that is one of 14 teams working across the state with an initiative that UNC is doing to address the issues around affordable housing. And it's designed to get us to work towards goals and strategies and standing up cross-cutting initiatives to try to do this work. And so it sounds like there's a really good collaboration opportunity to bring your group into the work that's been going with the group that we've had going. It's something that Spencer and Salisbury have partnered on with a few others in the community to be part of this. So definitely want to be in touch with you on that.
Yeah, absolutely. And Spencer has done a wonderful job. This is the last thing I'll say, and I'll step away. We have done a lot of collaboration with Spencer in the past couple years. We've done walking maps with different areas, and then with mental health, we've worked with Chief File on a variety of different things. You all were some of the first adopters of the 988 stickers that went on the fleets of fire trucks and police cars. So y'all are really doing a wonderful job in Spencer to lift up public health, and it really shows that you care a lot about your community. So I was very excited to be able to present to you all, because I think you all are one of the municipalities that get it, and you are crushing it. So
Thank you.
Thank you.
Thank you for the work you do.
thank you. All right, and if you have any questions, Ms. Moody has my information, and Peter has my information. So just feel free to reach out.
Thank
you.
Thank you.
Thank you.
Thank you.
Madam Pro Tem, may I make a comment?
Yeah,
Just
sure.
to Ms. Ledge's question. I want to say this slowly and in the microphone so everyone understands what I'm about to say. When I was at the Summer Attorneys Conference last month for county attorneys, the Association of County Commissioners is the umbrella for our county attorneys at conference. And so they had their legislative team present on the changes, the national changes to Medicaid. And what is fair to say, it is accurate to say that the big beautiful bill did not cut benefits. That is an accurate statement. What is misleading about that statement is that the qualifying requirements will double. So instead of having to qualify for Medicaid once, you will have to do it twice annually. So that means DSS departments will have to double in size. That means processing times will slow down. That means people will have to submit documentation twice a year, not once. Inevitably, I do not want to weigh in on whether that was intentional or not, but inevitably people who are on Medicaid now or who would qualify for Medicaid now will not be on Medicaid in 2 years because they will not be able to qualify to meet all the requirements. They may qualify, but all the paperwork and the twice annual qualification will remove people or prevent people from being added, even if they actually qualify based on income. So that is the impact that it's going to have. It's going to increase the local burden in tax dollars to pay more people that do not exist to process those claims, and is going to deny people insurance. Whether or not that's a good thing is a separate question. I'll let you decide that, but that is what will happen.
Thank you for that clarification.
Okay, any other comments or questions? Okay, then I guess we'll move to Chief Files report.
Yes.
Thank you again.
Good evening, Board.
Good evening,
evening,
Chief.
sir.
I appreciate y'all letting me present a few days early. Baseball season will be fully underway next week, and I will be out on the field coaching, so I could not miss the first game. So. Well, I wanted to go ahead and go over the monthly code report, and then I actually had a PowerPoint presentation to do after that, just to kind of, I guess, enlighten everybody about the status of the code, of our code enforcement, and maybe do basically a 5-year roundup, provide a little bit of information for you. But this month for our code report, we have 42 total cases. 20 of those were voluntary abatement already, and then 17 are still pending, and we've issued 7 NOVs on that. And for the 2025 year, we've got 299 cases thus far. So moving along well on our code enforcement. Obviously, it's still the summer months, so if you look at all the open cases, you'll see a lot of tall grass. What we typically expect for this time of year. So nothing too outlandish or crazy on this one. But I'll try to answer any questions you have, and I've actually got our code officer with us tonight. So if you have any questions I can't answer, I'll bring them up here and make them talk. But.
Regardless of questions, if you don't mind coming up now, we don't usually get to see you at the meetings, and I'm just really impressed by your reports every month. I really appreciate your approach to human beings. I think your voluntary abatement numbers are superb. And I just think that you really add a lot of positive action in the town of Spencer that we don't often find in other places. So there's been a tremendous improvement since you've joined the team. I really appreciate everything you do. So thank you so much.
I won't put you on the hot spot too much. Let you speak. We'll let you speak if you want to speak. Well, perfect. We'll jump right into the code presentation, and I will tell you. This is kind of brought about. I've received a little bit of negative, we'll just say some negative comments from some individuals concerning our code enforcement, and it almost felt like a personal attack. And I said, I want to provide the board and the citizens the real current status of code enforcement in Spencer. I know we talk about it every month. We talk about how good the numbers are, but I wanted to provide it. And I wanted to kind of explain what community-centered code enforcement is. So I'm trying to keep this as short as I can. It's only about 9 or 10 slides. So obviously, it's very much like how law enforcement can be community-friendly law enforcement or very aggressive. All we do is write tickets. And that's what we try not to do. Well, when code enforcement fell underneath the police department, that was kind of my goal for code enforcement, is to work with our citizens and not treat them as an enemy of the state. So that's what community-centered code enforcement is about. Obviously, we deal with the same stuff. Everybody knows what we deal with: junk, high grass, illegal parking, housing issues, etc. But we strive to do this, and this is what community-centered code enforcement is about: efficient, effective, yet friendly. Because we don't have to beat people into submission; we just have to work with them. Now, obviously, everybody knows we used to have to do a bunch of liens on property. I don't think, we'll look at Preston, we've not done a single lien since Preston has been in as a code officer, and that's because we're getting so much voluntary compliance. Saves a lot of time on our end, saves a lot of time going to the clerk of courts, and it saves a lot of fines for our citizens that may not have the ability to pay those fines. So we try to work with them rather than beating people into submission solely by monetary penalties. What I wanted to kind of go back and do is look at what code enforcement has looked like for the last 5 years, because I think this is really important to kind of show where we've moved to, and you're going to see the drastic change that occurred back in 2024. So in 2021, for the calendar year, we have 414 cases. Out of those, 47% were voluntary abatement. Remembering voluntary abatement means that at some point during that case being resolved, they complied, and we didn't have to go to any sort of a fine. So we have 47% voluntary abatements in 21. Jump up to 22, 379 cases, 44%. So staying staying pretty consistent there. 2023, 415 cases, a little bit more, 38% voluntary abatement. If you look at the chart, enforced abatement, 191. So that's where we had to go out and force the citizen to comply with whatever the initial complaint was. Whether that ended up with Joel's crew having to go out and mow yard, or us having to remove junk from a porch, and then us going back and putting a lien on property for the man hours that it took our employees to go out and resolve the issue. 2024 is where it starts getting good. We hire Preston. We'll give him a pat on the back here. 483 cases, 56% voluntary abatement. Remember, Preston came towards the end of 2024. So we're already seeing those numbers shift. The blue block getting way bigger, voluntary abatement, the green block going way down for enforced. Jump up to this year, January 1st to present, so 8 months of data here. We've got 300 cases thus far, 79% voluntary abatement. If I understand right, after today, this was done yesterday, it's about another 10. So we're going to bump about 10 more off of that category that shows 44 open. There's about 10 more that have joined the voluntary abatement group. So we're over 80% as of the report tonight. So those are the type numbers we like to see. We want to know that we can go out and work with our citizens. We don't want to beat people into submission. Citizens are not our enemies. And I felt like some of the comments I was getting from the public was that we're not being mean enough to our citizens, and we're not going to be. Absolutely not. That's not what we want to do. We want to see these type numbers. I want everybody that's watching at home to understand this is what we want. We want to work with our neighbors, not beat our neighbors down. And sometimes it's as simple as your neighbor can't mow the grass because they're elderly, and maybe the kid next door needs to go mow it for them. So that's what we kind of try to foster. I always harp on this, how cases can be generated. Everybody knows iWorks. We've been using it for 5 years. That's where all these numbers come from. We track every single case that we deal with. Every case that comes in through iWorks, the citizen portal complaint, it all goes to the same portal where we can pull numbers at the end. So citizens key in the complaints. Every case gets a site visit. Every single case that gets keyed in is guaranteed to get a site visit. Preston goes to every single house, typically twice. We'll talk about that here in just a second. Patrol is kind of secondary. That's the code officer riding around, or some of my guys. We still build cases here and there. If we see a case that's in violation, we can build it while we're on patrol. So the code officer builds the cases based on priority. And that's what we kind of talk about. Typically, spring and summer is all overgrowth. It's just what we can deal with, remembering that 10 years ago we had 3 code officers. We have 1 now, so we're working with what we've got, and we're still maintaining. So I think that's a good sign. It means we're more productive with the numbers of employees that we have. So spring and summer being overgrowth, fall and winter, we concentrate more on housing, junk, the illegal parking issues, the stuff that may not be deemed an immediate threat. So we try to play catch up on all the remaining stuff that is in the system. How we work with the citizens though. Site visit, that's what Preston does every case that comes in. He makes an initial site visit. Here's the numbers that I want the citizens to understand, and I just want to reshare with the board. I know we've talked about this before, but when Preston goes to a house and makes an initial site visit, he gives them written notification and 7 days to correct it. So the case has then been built, is in the system. At the conclusion of 7 days, he will go back, second site visit. If the violation is corrected, then that's what moves to voluntary. So we basically told the citizen, hey, we've got this complaint, here's the problem, here's what the ordinance says and what you have to do to comply. Please fix it in the next 7 days. And to kind of add to that, we work with some. I know you see sometimes on your reports where it may look like a case has been on there for 2 or 3 months. So if, for instance, we have a parking issue where they don't have an approved surface to park on, if they are working towards getting it resolved, then obviously we give them more time. So if they provide quotes where they've had a contractor come out and quote for the repair, if they show some movement, they've had gravel delivered, they've got it marked off, staked off, they're getting locates done or whatnot, we work with the citizens to resolve the issue. We don't want to fine people needlessly when that's the money they need to actually fix the problem. We'd much rather that go to fixing the problem than go back to the general fund of the town. So if the violation is not corrected, then a official NOV is sent out, and this one is stated in our codes and policies. They have 10 business days to correct the violation. So at the conclusion of that 10 business days, if they have ignored 2 site visits from our code officer and ignored the official notice that's delivered to them, At that point, we would abate the property. So very low numbers that we actually have to do that. There's a few that are keyed in there right now for abatement, I believe, that are probably going to go that direction. So next month there may be a few that are abated in there for grass, where Joel's crews have to go out and cut a yard, and then obviously we have to bill the individual. But it's all past these timelines. So I just thought it was important to share with you kind of how we're handling everything. I didn't like the comments that were made that made it look like we were being lax and that we're just not doing what we should, but we don't think we should rule with the iron fist. There is another, we've all attended code enforcement training. I went myself. I expect, Preston's been, and I expected that he could ask me anything and I'll be able to answer it. So I wanted to make sure I knew, so I went myself. There's another avenue of code enforcement, which is very much, this is it. First visit to the house, here's your official notice. We're back on day 11, and we bill you on day 12, and I don't like that. The board ever decided that was the way we wanted to go. Obviously, that is definitely the board's direction, and we would look at doing it that way. But I tend to believe the friendly version works, and the numbers show that the friendly versions work, especially with our voluntary abatement numbers. 80% outstanding. I think overall we'll probably wind up at about 85% by the end of this year will be our whole calendar year 2025 numbers. So 85%, probably some of the best that you'll ever find for any code enforcement anywhere within the state. So I wanted to share that with you, and I definitely will try to answer any questions you may have, and hopefully that kind of sheds a little bit of light on how we're doing things. And I'll turn it over to you. I'll quit talking now. I know everybody's ready to go home.
So what? And just more for my information, also for folks at home, what happens in the 1% or maybe even 0.1% of cases where we're past past abatement? We're now on, second or third set of abatement. I mean, at what point does it become okay? This is something more than what happens then? Or when does that happen?
Right. Okay. So effectively, you mean multiple abatements at the same parcel?
Yeah. At what point is it kind of
there's
actually a bigger problem? Yeah.
There's actually some. The code actually allows that if we have a habitual offender, we'll call it that, habitual offender. At some point, we don't have to abide by the time periods any longer. We're able to jump directly to an abatement. And there are some parcels that have been that way. Me and Preston just went over one a little bit ago. It was one of our target homes, which we may share that at some point. Probably next month we'll share that one. There'll be pictures of it, hopefully. But it had hit that point where Joel was just having to send his crews out to mow it. And obviously, I think we levied a lien against them last year. It was getting ready to go to another lien. Now they've hired a yard company. That home is actually went into the hands of a responsible person that's going to take care of it. So, once it gets to a certain point, we can kind of start going past, kind of skipping past the timelines. But effectively, the way we do it, if it's an individual complaint, so say you have a high grass nuisance complaint at the house, and then 2 months from now there's a junk complaint, they're handled totally independent. So it doesn't really become habitual until it's the same type complaint that we started dealing with, and then we'll kind of move to where we start abating it, a little quicker. I don't know if that answers.
No, it does.
It does.
It does.
And Preston probably knows the exact timeline. He's a timeline person. So he can probably tell you.
After 3 official notice violations,
After the third official novation.
Gotcha.
So, I always have to reference my cheat sheet. I don't do it enough every day. I know enough to get myself in trouble, not all the numbers with it. So, but so there are ways to move a little faster on it. But we don't have many that hit that point. And I know we've talked about this before, but our landlord ownership has went down in the city limits. So not that was always bad, because we had some really good landlords, and we still have some really good ones. If you call and say there's a problem, they're out there. We called one in Charlotte last week. Like, he's out there. Like, he sends somebody from Charlotte to take care of the problem. So we do have some really good landlords, but as went down and our ownership has went up, so we've seen a little bit of a shift in that, because home values have went up. People are putting more into their houses, and the days of having the $40,000 house is gone. There's kind of pros and cons to that, but the pro for us is people are putting more into the ownership of their house, so we're not having quite as a big a problem. Now, there are definitely still issues, no doubt, and they pop up here and there, and a lot of times we find out it's actually citizens that don't really understand. Yeah. They don't understand that they can't put stuff on their front porch. They just don't understand why. You can tell them it's in the code. They're not going to agree with it, and they'll remove it because you come and ask them to. But they still don't understand why. It's my porch, my property. I want to put what I want on it. And that's the unfortunate part to try to, sometimes you have to navigate that kind of with tiptoes,
What if anything, could we do that could, I mean, for example, you guys have kind of been doing the setup for now, I think we're right at a year, maybe a little more than a year. What a year in, kind of as a digest, what could we do differently or better? Or, I mean, for example, do you need more help? I mean, I know the answer is always yes, but I mean, like, what can we do to help?
Yeah, I mean, ultimately, the only way to ever move, if the complaints come in, we always have to prioritize. I know we talk about that a lot, but we really do have to prioritize. We could go out there right now and build 300 code cases tonight. Without a doubt, we could find probably 300 violations, but there would never be the manpower to follow up on them.
Sure.
So we're very much reactive driven based upon the portal complaints. We respond to all portal complaints first. Every case that comes in, even if Preston gets overloaded, every case that comes in through the portal gets responded to, and it gets a home visit or a site visit. Other than that, when his log is busy, he obviously does not actively go out and just ride the streets looking, because he's actively following up on all the ones that have came in through the portal. So about 40 or 50 cases a month is a really heavy month, and that's a hard month to be able to make 2 site visits, 2 contacts, send out NOVs, collect fines, whatever the case may be. So yeah, ultimately it does come out of that. If we ever wanted to push to just really doing more cases, we'd have to have more manpower to do it. We utilized a little bit of part-time help at one point in time. I will say that there is a little bit of an issue with utilizing like outside part-time help, and we ran across that before when we were using the contract company. It's hard to keep the cases separate and to be sure that they're followed up on in a timely manner by the same code officer, to where the citizens aren't getting, this guy said he would let me slide on having the Rubbermaid tub on the front porch, and this guy says that it's not allowed. So there is a little bit of an issue there, where if we ever went back to that model that we had more, we would obviously, all these 40 cases would be assigned to code officer 1, and these 40 would be assigned to code officer 2. We'd just get double the amount done, but we still would probably keep them separate between officers, and that way you're not mixing messages up with the citizens. But aside from that, it really is pretty fluid. iWorks is a great program. The citizen portal is great. It works good. Citizens can go back in there and get some form of follow-up. It's a little limited, the information you can get. A lot of times Preston's notes that put in there may not be stuff that will be released to another citizen per se. But they can go back in there and see if their case has been abated or how it was handled. And then obviously they're always welcome to call up here and check on the status of the case too. So Preston gives out a lot of business cards. So there's only one of him to go around, but he deals with a lot of calls. So.
Quick. I'm asking a lot of questions. I'm sorry. I'll be quiet after this. I did speak to the individual. I think many of us did, and some of his concerns were I thought were valid, in that he was frustrated by the times allowed, and what I explained to him is, I think what I'm about to ask is that, and I do this in Davidson. This is what I do in Davidson County. I'm with code enforcement on the legal side, but there's a due process where we have to give someone time. And if, when we go in front of judges in Davidson County, if we've not given them, unfortunately, sometimes months, sometimes years to fix a problem, they're not going to do what we're asking, just because it comes across as ticky-tack and tedious. And so, I guess talk about, just again, more for the benefit of the folks home, the why it's important that that we meet that due process aspect of, you have X number of days, and then I'll be back if it's not done, because otherwise, we don't get the result we want, right?
Right. And so, you're right. Some of it is, I will say, some of it is unfortunate on our side. We kind of feel it's unfortunate at times if we really do need to push an issue, quite quickly. A lot of times the code lays out very specifically how we do it. But when you go before a judicial official and you start talking about, this problem, forcing somebody out of a house, I know that's been brought up, like, oh, we've got housing problems, we need to kick people out of their house. Well, what I may consider a livable home may not be what the law considers a livable home. It 100% is not. Working on the law enforcement side, quite often we go into homes that I would not let my kid live in this home. I see this and this and this and this as a problem, but according to the law, it's okay. And that's the problem of, there's a lot of opinion involved, and there's a fine line between what we can actually push through with the judicial process. And then, quite frankly, when you start talking about the government messing in people's rights and in their home, and a lot of individuals do not look at that lightly. So we really try. That's why we really try to fix the problem. And if it requires us taking extra time, I think everybody knows the house here that was ran into them. It took us over a year to fix that house. But those people were victims. So we could have went in there and pushed the legal process on them very early on. It was obvious the house was not in a livable condition, but we worked with them, and everybody got happy resolution. My understanding is the house is going to be tore down. There's going to be a nice new house put there. The individual that sold the house actually recouped a little bit of funds. So the whole thing worked out for the benefit of everybody. So there again, that's why we really work through the timeline. But in all honesty, there are very few that go significantly past the timeline. The problem is when citizens see a repeat offender, if that case has already been closed, they have to report it again. Just because, 123 Main Street has been reported in 2024, if it has been resolved to the satisfaction of that initial report, that case is closed. You're green in our book. You're good. So unless it is re-reported, I'm afraid a lot of people don't re-report, and then they get angry that 123 Main Street, I'm just using a fake address, that address looks bad again. But it's got to be re-reported. And there again, that's that thing where if we get to multiple violations at the same address, we can start moving further and further as far as potentially shortening the process on how we handle it. So it's a lot of hoops for us to jump through, unfortunately. But
the other factor when you talk about times is we're creatures of the state, and everything we do is based on state law.
Yeah.
And we're going on the state provided timeline based on our general statutes. And maybe everybody in Spencer would vote to say we'd like it to be resolved in 3 days, but law isn't set up that way.
Do you find that the same people are making reports on a consistent basis? Not victims. I mean, not the people being
not
reported.
always as a rule of thumb. We had a little outbreak of that. I will call it outbreak. It wasn't necessarily bad. We had an individual in town that started making a lot of complaints and probably made 20 or 25 within a 2-week period, which was hard to keep up with. But all 25 of them got a home visit or got a site visit, and I would say we're over 80% of those are resolved now. Yeah, I think probably over 80% of those that were reported have been resolved now. By next month's board report, they'll all be resolved. So it's we always encourage everybody. We don't want somebody to go in there and try to dump 100 cases on us, because then we would hit an issue to where we just don't have the manpower. We wouldn't know how to handle it. How would we ever handle 100 cases got keyed in next week? We don't have the manpower to follow up on it. But if people see complaints, we definitely encourage them to, or see violations, encourage them to put the complaint into the portal. There again, the portal takes priority because every morning Preston opens the portal up and gets all the new ones that have been keyed in. Some mornings there are none, some mornings there are 10, and then he starts following up on those. So that kind of starts that time clock. As soon as he makes that initial site visit, they get their first 7 days. They get written notification on the very first visit. He talks to them and written notification. If nobody's there, he still tags the door with written notification. It still starts the 7 days on his very first visit to the house. So, but there's definitely repeat offenders in town. There's no doubt. There are people that repeat, and there's issues that I know I did in that little brief time where I was kind of juggling and doing code enforcement before Preston started. Like I saw one today that came back up again for a parking related issue. Everybody knows we don't have room to park a lot of cars in town, and I looked at the pictures, and this house has more cars than they had last time. So they've obviously bought another new car since then and kept the one they had. So they already had a problem. Now they bought an extra car, and I think he's working on that as far as getting another expansion to the gravel pad in the yard, so they're back out of the grass. So the days of one car households are gone, I think, and more often we're seeing 3 or 4. So definitely a little bit of an issue whenever you live inside the city limits, but we're certainly working through them, and hopefully tonight has helped a little bit and kind of explain how we're handling it. And definitely, if you have any other questions, I'll certainly try to answer them for you.
Okay, so if there's an abatement by Public Works, you send the person whose property it was the bill, and if they don't pay it, it becomes a lien? They have-
Ultimate,
they
yeah,
have the
ultimate becomes a lien. Now, we're not being as aggressive filing these small liens. I know,
Right.
for those of you who were around when James was here, he would come in here and get liens filed sometimes that were only $200 and small ones. We're kind of letting them stack up a little bit before we go and take it up to the clerk's office and have it done. And fortunately, it seems to have worked out. We've been getting some pretty good sheets where we're getting payments. There again, Preston probably knows numbers, but you took in, what did you take in last month? About $700 maybe. I think about $700, and we never went to the lien process. So the individual said, "Thank you for doing what you did. It was my fault." And they came up here and paid. So certainly we like to get to that before. We may have one or two that's going that direction in the next 2 or 3 months. I'm hoping they'll resolve it by the end of the year. If not, we'll probably have to bring a few forward. But that's going to be the first ones we've done this whole calendar year. So.
Yeah, I know. It's not been listed lately, but I know at one point there was a particular individual who I think was a very elderly woman who had property, and she was constantly being on that list. And I mean, yeah, if you don't have the money to pay to have somebody mow your yard, then you probably don't have the money to pay a fine either.
Right. I think most of those have kind of fallen off. I don't think we're not dealing with that one anymore. So most of those have, we try to work with them and send them in the right direction. And most everybody is really, we're getting way higher level of compliance than I think most people understand. I mean, I know the numbers. Numbers do a lot. I like numbers. It helps me show what we're doing. But really, to go out and say that 4 out of 5 people that you talk to are voluntarily just doing it. They're just doing what we ask them to do. That's pretty good for having a gift of gab, I think, and convincing everybody to do it. And the thing is, a lot of those we're not having repeats. There are the few that have repeats, but a lot of these cases we've got new people moving in. Quite frankly, a lot of it's just citizen education. Most people don't go out looking for ordinances and try to figure out what the ordinance is. A lot of it really is just educating them, and then we don't have to talk to them again. So.
Well, I just want to say that I've heard from citizens that they really appreciate how you manage things. And I don't say this to minimize the importance of code enforcement, because I would be absolutely terrible at this job, okay? But we sat here this evening and we heard that we're almost a quarter of our kids are food insecure. And so what I want to say, for sometimes when we hit bumps in the road where people may be a little harsh on this humanistic approach to getting things resolved in a way that's best for the citizens but also has the needs of the town done, is maybe we just need to look at the bigger picture sometimes and realize we've got almost a quarter of our kids going to bed hungry a lot of the times. And so we've got bigger fish to fry, and I really appreciate how hard you guys work, but how hard you work on behalf of the citizens and not just against them. Because I'm really proud to, when I hear these things, and I love living in this community. And so I want you guys to know that I take complaints with a real grain of salt, because I frankly would have to call and do a lot of research to look up an ordinance and understand what it means. I probably have to call you. So I know how much goes into this, and I appreciate that you guys are working with people and not against them. So thank you.
Thank you.
Yeah, I agree. I think the philosophy of what you're doing is right. We're not Charlotte. We don't need immediate results as far as they go. I understand there's people out there, and I've got some friends that've been complaining about this. But they got to listen that this is a small town, and I don't want to lose a small town up here. I appreciate what y'all do.
Thank you.
And I appreciate the approaches you use in both police work and code enforcement. And I think it's good that we come across as a town that cares, and I think that's important. And one thing also, I've noticed there's a lot more individual pride in the community, and even some homes are just having miraculous do-overs and being posted for sale. And I mean, they looked uninhabitable. And I'm amazed that people will invest and come in and do this. And I think part of it is probably because of the attitude from our police and code enforcement.
And yes, I know we have some people that, try the rules and whatever. And I know in education, we had to choose our battles with kids. You're not going to write a kid up for chewing gum. And a lot of times people would, teachers would, and call the kid to the office. And there are so many other ways to handle that. And, I think the way you're handling it, using your heart and good judgment and consistency, and the numbers are proving that it's getting better. And I love the results, so keep it up. And we'll keep encouraging our citizens who are lagging behind a little bit to try to do better.
Definitely, definitely. Well, I appreciate it. Anytime, feel free to reach out to us. We'll certainly try to steer the citizens in the right direction and encourage them to use that portal. that really is the most important thing for us. It really that makes or break it, because if we ever came back to the board and said, I need extra help, it's hard to justify extra help if we don't have the cases going into the portal. So that really is important.
Yeah,
And as the community grows, we're really going to have to push the portal use. There again, we're never going to be able to go out and actively just ride the streets all day long, because we're already doing other stuff during that same time, following up on the cases that have already came in.
So, and I guess that's a great question. At what point, as soon as the townhomes are completed, that's going to increase the population by 300 to 500.
Right.
Just like that. New homes being built pretty much nonstop in the last 2 years, which is great. At what point does that caseload? I mean, I guess at what number does the board need to say, we've got to give Preston some help? Because again, I think he's doing a great job. So I mean, at what point do we need to be aware of that?
Yeah, that's gonna be a hard number to guess. I mean, that's realistically, we're busy right now, so that's kind of a bad thing, but it's a good thing. We're busy right now, so if you're actively working 50 cases a month as a code officer, that's not a terrible number. That's a pretty firm number to actively be involved in 50 cases, because there's moving parts on them. You've got carryovers from the month before, and then all the new ones that are coming in. So there's new timelines starting. You're right. I mean, once we're just hopeful that, say, the new townhomes come in, they're all going to be very respectful to each other, and everybody's going to follow the rules. But we know that's probably going to be short-lived, unfortunately. So at some point, when it gets to the point where our portal complaints are not able to be sustained, we'll kind of know when it starts getting there, when we're not able to follow up in our timelines anymore, where our 7 days has to start going to 12 and 13. Because naturally, that's what's going to happen, is the timelines are going to extend out just by the fact that we don't have the manpower to follow up on it. So when we get to that point, then that will be when we're going to have to look. Hopefully that's a year or two down the road, but that would be when we have to start looking at what's going to be our backup plan as far as either supplemental part-time help or a whole secondary person. So
maybe we need to do a welcome package so that people moving in know what the rules are.
It'd be a big welcome package for law ordinances. Ooh.
Okay, any other comments or questions? Okay, thank you very much, gentlemen. Appreciate it.
Thank you. Well, I can keep the PD report very short.
Huh?
I said I can keep the PD report very short tonight. I provided the normal report this month. You will notice that it is missing the ACE team report. It's because we still have one ACE team car. He's still out on medical from his traffic accident. The other one we have pulled training a new officer, so he's actually back on the patrol side right now. So there were 2,038 events this month, keeping in mind that we've got openings right now. So, those numbers are trending towards 3,000. That's just, there's a lot of proactive work that is kind of missing from the report because we just don't have the manpower out there. So there's less people doing it. But we're getting pretty close. I think by this time next month, the most recent new hire will be released to go out on his own car. And then the first ACE team car will be going back to his normal position. So these numbers will start shuffling a little bit back around again, and there should be another ACE team report back in there for next month. There were just, all those were zeros this month as he was letting his trainee do all the work. So red inking all the papers. But I will try to answer any questions you may have about the police department report this month.
Were you going to talk about the Norfolk Southern grant?
Yes, I'll stick that in whenever you're ready for it.
I guess we are.
All righty, ready. So the Norfolk Southern grant, this was kind of a short ask for forgiveness because I went on and applied for it type paper. But so we were contacted by a manager with Norfolk Southern. They have a community safety grant, and it kind of focuses on mitigation of criminal activity. And obviously, when you start measuring out now that we've basically got jurisdiction from the edge of Salisbury all the way to the river, we've got about around 4.7 miles, I believe, of rail line. And then, we've got the backup yard I don't know what they call it. They call it, all the guys that work for Norfolk Southern call it the Spencer Yard, but it's really an extension to Linwood. That's within our jurisdiction. So we've got a lot of rail line property. So they encouraged me to quickly, because I had about 3 or 4 days to write a grant. They encouraged me to quickly get that submitted, and it was for a $1,000 to $15,000 grant. So we submitted a grant for just under $12,000. We don't know. We haven't got follow up yet. It's been accepted. We don't know if we're going to get the grant, but it's to provide funding for the drone. We tried to get that the last couple of years out of our budget. So it will provide funding for the drone, which is actually going to be exceptionally helpful for the rail line, because we get calls on the rail line, and it will be way quicker than having to try to go by foot up the rail line to send a drone up the rail, check for trespassers, check for fires, check for anything, injured individuals, anything that may affect us over there, and then we'll get the double benefit of being able to use it, obviously, all over town. So we're very hopeful, fingers crossed for us, that we actually get this one. So
that was as Chief Powell mentioned, that was a budget request for the last few years that really didn't even get to make it through into the recommendation. But it also is one that would likely have benefits even for fire department use, maybe even public works use, etc. So it's a multifaceted tool that, if this grant could supply, it would be very beneficial.
Do you all? Somebody asked me one time if you all controlled over in that area that's kind of no man's land on the railroad.
Well, yeah. So there's lines all cut there. It's very weird. If you go look at GIS, there's some property that's like random property in the middle. Like, and it comes back and says Greensboro, and it's got a lot to do with how the railroad, I guess, has stuff listed. But yes, we actively patrol that. So anything, we've got the contract with the Transportation Museum, and they keep cars parked along those rail lines too. They're actually Transportation Museum's property. So we actively patrol the rail line, all back behind the museum, all the way up to that, what they call the Spencer Yard area. So we're actively out there every day, multiple times. So,
are there any homeless encampments in that area?
We don't see many. We had a report of one about 3 or 4 months ago, and we checked on it. It had already been abandoned. I've got no doubt that it happens at times. If you remember a few years ago, I guess it was going back to 2021 or 22, we had a rail car that caught fire over here, and that was by an individual that was homeless that was living in it. So it does happen at times. The problem that we see, and this is a problem that plagues every set of railroad tracks, obviously, is that we've got transient traffic where people are walking across or walking parallel, and they're going from East Spencer to Salisbury and back, and they walk the rail line, and obviously there's significant danger there. And the railroad is very strict on that. That is trespassing, period. They want people off. They want them arrested. They're very strict about that. And they've got a police department that's actually the Norfolk Southern PD, but they're very limited on the number of agents they have in the area. So quite often, if they have problems like that, we'll go check it for them. They obviously have jurisdiction if they want to, but they may be coming from Charlotte or Greensboro to come to Spencer. So we'll obviously get there before. And we have good open communication with them. So.
Do we need to vote on this retroactive permission?
So yeah, just a motion to authorize staff to apply for the grant would be.
I make a motion to authorize staff to apply for the Norfolk Southern Safety Initiative grant.
Thank you, Alderman Moody. Second.
I'll second.
Thank you, Alderman Sledge. All in favor? Opposed? Okay, carried unanimously. Thank you. And good luck. Let us know.
Thank you. One last thing, just a reminder, I know everybody will be there because I think it's still going to be park open tonight.
Yeah.
October 7th, National Night Out. It's going to be a big event. We've got a lot of confirmations for people. Some of those funds that I believe were in there tonight are for some of our donations that have already been made. So, we've really tried to expand on National Night Out this year. I believe.
Looking forward to that.
I'm gonna wait and mention the names later. They'll have signs out here, but I know the dunking booth has already been paid for by an individual in our community. The band has already been secured by an individual in our community. I think the hayride has already been secured by an individual in the community. So we're very happy with what we're starting to see on that. So we hope to have a really good turnout. Cross your fingers for no rain this year. Gonna be a lot of stuff to put up if it rains. So.
All right.
All right, thank you.
Good luck at the
Thank you.
game.
Thanks.
Okay. Is there a need to go into executive session this evening? Okay, if not, is there a motion to adjourn?
So moved.
Thank you, Alderman Muhammad. Second?
Second.
Thank you, Alderman Moody. All in favor? Meeting is adjourned.
Thank you, Ms.